Good evening, everybody. Welcome to our Facebook Live. This is Dr. Mamta Dighe. I am the director of Xenith Advanced Fertility Centre. We're based in Pune, in Wakad, as well as Goregaon Park. Just a brief introduction about myself. I have been doing infertility for more than 25 years now. I would say 23 years. I started this practice in 1999, where there was hardly anybody doing infertility and IVF in India. I worked with Dr. Kamini Rao, who is a Padma Shri now, and I've been doing IVF since then. I'm amongst the first few doctors in India who completed their fellowship in IVF and reproductive medicine, and I've been exclusively practicing infertility for the past 22 years. It's been a wonderful journey. I am the past president, a program director, not the president. I have been the program director at the IVF Center of the Nanath Mangeshkar Hospital, and I was the director there till 2015, and then I started my own center, which is Xenith Advanced Fertility Centre. So this is just a brief introduction. Today I'm also going to be speaking in Marathi, which is wonderful. It's my mother tongue. So I'm going to have a mix of both these languages, and then eventually also try to do an FB live in Marathi for all the Marathi speaking people. So welcome. Thank you for spending your precious time on a Saturday evening being with us. And I will try and make this a time worthwhile and well spent for you. So today we are going to discuss unexplained infertility. Okay. So what is unexplained infertility? आज आपण unexplained infertility ह्या विषयावर बोलणार आहोत. ज्या वेळेला आपल्याला इन्फर्टिलिटीचं कारण सापडत नाही, त्यावेळेला अशा प्रकारच्या इन्फर्टिलिटीला आपण अनएक्सप्लेन्ड इन्फर्टिलिटी असं म्हणतो. सो लेट्स स्टार्ट ॲट द व्हेरी बिगिनिंग. ओके, फर्स्ट म्हणजे व्हॉट इज इन्फर्टिलिटी. मला माहिती आहे की अ लॉट ऑफ पीपल विल हॅव अ लॉट ऑफ नॉलेज अँड इन्फॉर्मेशन ऑलरेडी रिगार्डिंग दिस, but I always feel that getting to hear something from a doctor directly and understanding the nuances still makes a lot of difference versus just reading about it or listening to something randomly. So I'll try and make sure that I completely help you understand what this is all about. So what is infertility? Basically, when a couple is trying for a pregnancy for a year or more and has still not been, just give me a minute, and has still not been able to conceive, then we call it as infertility. So ज्या वेळेला एखादं जोडपं 1 वर्ष प्रेग्नन्सीसाठी प्रयत्न करत असेल, आणखीन हे करूनही जर गर्भधारणा झालेली नसेल, तर अशा वेळेला आपण ह्याला वंध्यत्व असं म्हणू शकतो. सो दिस इज बेसिकली हाऊ इन्फर्टिलिटी इज डिफाईन्ड. जर इन्फर्टिलिटी ह्या कॅटेगरीमध्ये किंवा जर आपल्याला हे डायग्नोसिस झालं की नाव देर इज इन्फर्टिलिटी, द नेक्स्ट स्टेप is trying to find out what are the causes of not being able to conceive. So basically what is happening is this is the female reproductive tract. So the female reproductive tract consists mainly of the ovary, the fallopian tube, and the uterus, and of course the vagina and the cervix, and there are other things, but these are the 3 main components. So every month ovaries that are there in the woman, they carry the eggs. So जे बीजअंडकोश असतं त्याच्यामध्ये स्त्री बीज किंवा अंडी असतात. Now every month one egg from one of the ovaries will mature and it will come out of the ovary. So this is called ovulation. It is only after ovulation that the egg is available for fertilization. So once the egg is out of the ovary after ovulation, these fimbria हे जी गर्भनलिका आहे, if you can see over here, there are these structures. These are called fimbria. अशी बोटांसारखी पसरलेली आहेत ती. So they kind of go and grab the egg which is getting released from the ovary, and the egg starts traveling inside the tube. So from the ovary, the egg is starting to travel inside the tube towards the uterus. When intercourse happens, the sperms are deposited in the vagina. From the vagina, the sperms have to travel up through the vaginal tract, through the cervix, into the uterus, and this is where the sperms come from, and they enter the fallopian tube from the other side, and the egg and the sperms will meet somewhere in the fallopian tube. The sperms will fertilize this egg. This egg will form an embryo, and then over the next 4 to 5 days, the embryo will travel and will come into the uterus and will get implanted in the lining of the uterus, which is the endometrium. So this is where the embryo will stick, and it will burrow inside and will get covered by the endometrium, and that is how it will result in a pregnancy. So, the few basic things that are necessary for any couple to conceive are the 4 basic factors. First is the egg. म्हणजे बीज अंडकोशेमध्ये चांगल्या प्रमाणात आणि चांगल्या क्वालिटीची अंडी असणं खूप गरजेचं आहे. So you need to have good numbers of oocytes, eggs, as well as good quality of these eggs to give a pregnancy. That's the first factor. The second factor is the tube. The tubes need to be open, patent, and healthy to do their function of transporting the egg and the sperm. The third is the uterus. The uterus has to be normal, the lining has to be healthy, the uterus has to be free of any adhesions, any fibroids, any other problems inside it. It has to be of a good and normal shape and size to help that embryo to implant inside. And the fourth factor is the sperm, is the semen factor. So ह्या 4 गोष्टी, बीज अंडकोशेमधली अंड्यांची संख्या आणि क्वालिटी, गर्भनलिकेची पेटन्सी, गर्भनलिकेची हेल्थ, गर्भकोशेची हेल्थ, त्याच्या गर्भकोशेच्या आतलं जे स्त्रव किंवा जे एंडोमेट्रियल लाइनिंग असतं त्याची हेल्थ, आणखीन द स्पर्म्स. All these factors being normal are the basic workup that we do to understand कि infertility चा cause काय आहे. So this will let us know कि what is the cause of infertility. Now, the basic tests that we do whenever a couple comes to us with a case of infertility is to understand whether ovulation is happening properly, how the semen analysis is. We do an ultrasound sonography to understand how is the uterus, how is the lining, and then we go ahead and do a tubal patency test, which is called an HSG or a hysterosalpingography. So ह्या बेसिक टेस्ट आपण करतो ज्याच्यामध्ये आपल्याला बीज अंडकोशेची क्षमता कशी आहे, काम कसं करतं आहे, how are the tubes, the uterus and the sperms. We get a basic idea about all these 4 things. Now usually we tend to find a cause somewhere amongst these 4 factors. And in infertility, about 30% of the cases are related to a female problem, 30% are related to a male problem, 20% of the times it is a problem in both. So, it kind of covers, and the remaining 20% of the times we fail to understand what the cause of infertility is. म्हणजे 20% वेळेला आपल्याला ह्या सगळ्या टेस्ट करूनही सगळे रिपोर्ट्स नॉर्मल दिसतात, आणखी मग आपल्याला कळत नाही की इन्फर्टिलिटीचं कॉज काय आहे. अशा वेळेला दिस type of infertility is classified or categorized as unexplained infertility, where we do not understand what is exactly happening, that despite having these basic factors of eggs, sperms, tubes and the uterus seemingly look normal, pregnancy is not happening. So now let us delve into what are the causes of unexplained infertility. We've understood when we would say that it is unexplained infertility. Now let us find out what are the causes of unexplained infertility. Now first and foremost, what I would like to say is that आपण जे काही आता टेस्ट करतो आहोत, they are the preliminary tests, they are the basic tests. ह्याच्या पलीकडे पण there are certain things which are at a more subtle level, which are difficult to grab or understand by basic tests. And what could be the causes, seeming causes of unexplained infertility? कारण काय होतं is we say that it is unexplained. आणि बरेच वेळेला when couples come to me, they say की आम्हाला cause तरी कळला ना तरी बरं होईल. पण the fact is की प्रत्येक गोष्टीचं कॉज प्रत्येक वेळेला कळेलच असं नाही. Please understand that pregnancy is a process. Every nuance or everything that is happening with the process of pregnancy is happening inside the body and is happening at a microscopic level. The eggs are microscopic, the sperms are microscopic, the movement of the tubes are so subtle that you cannot pick up these movements. How the endometrium will have a crosstalk with the endometrium. So like I showed you over here, इथे तो गर्भ आल्यानंतर, okay, this embryo has to have some talk, between the endometrium, some reaction between the embryo and the endometrium, which then helps the endometrium to decide that yes, I'm going to let this embryo implant inside me. So all these small factors, it is impossible to do tests for it. But there are certain things which we can do after being diagnosed as unexplained infertility to find out what the causes could be. So the first, I would say that if I have to look at what the causes could be, I would say that one of the first causes could be a tuboperitoneal problem. म्हणजे what do you mean by a tuboperitoneal problem? जेव्हा आपण HSG करतो, when we are doing an HSG test, what we do is we put a dye, we inject a dye inside the uterus, and it is expected that this dye will flow from the uterus into the tube and will spill out of the tube. And when that is happening, an X-ray is taken which shows that the tube is patent. So an HSG will tell you the patency of the tube. But the HSG is only telling us what is happening with the inside part, which is it open or is it not open. However, there can be tubes that are unhealthy which are open. So you could have a very rigid pipe-like tube which is actually open, and an HSG will tell you ki he tube open ahe, but he tube functional nahi hai. This tube is of no use because this tube will not be able to make the subtle movements of the tube that are necessary to push the egg towards the uterus. So a tube which looks patent on an HSG may not always be a healthy tube. That is the first factor. The second factor is that kadi there are adhesions, that is these tubes are held back due to fibrous tissue or other flimsy tissue which is attached to other organs inside the abdomen. So if these tubes are adherent, they are stuck up somewhere, ही ट्यूब जरी मोकळी असली, जरी ओपन असली, जरी पेटेंट असली, तरी the adhesions will hold back the tube and the tube will not again be able to do the movements that are necessary to be a functional tube able to give a pregnancy. So tuboperitoneal factors are very important factors which get missed because they cannot be assessed when you do an HSG. Third, हे जे मी फिम्ब्रिया सांगितले, these finger-like projections which go and they are very close to the ovary. These are the projections which can take the egg or suck the egg inside the tube. So, if these fimbria are unhealthy, again, or they have just clotted together for some reason, then the fimbria will not be open to take the egg inside the tube. And even if you've done an HSG, त्या फिम्ब्रियामध्ये थोडंसं जे काही ओपनिंग असतं त्याच्यामधून डाय बाहेर जाऊ शकेल, पण the tube will not be able, the fimbria will not be able to take the oocyte inside the tube for its fertilization. So these are the tuboperitoneal factors that actually are present but cannot be assessed by the first set of investigations that we are doing. So when we say that this person has unexplained infertility, there could be these tuboperitoneal factors inside the abdomen which are actually the cause of infertility. Even the relationship of the tube and the ovary, म्हणजे ट्यूब आणि ओव्हरी कसे रिलेटेड आहेत, कारण इफ द ओव्हरी फॉर सम रिझन इज अध्यरंट, म्हणजे ट्यूब ओपन आहे, सगळं नीट आहे, पण ही ओव्हरी कुठेतरी युट्रसच्या मागे किंवा युट्रसला बाजूला जाऊन चिकटलेली आहे, तर अगेन द ट्यूब विल नॉट बी एबल टू रीच दॅट ओव्हरी टू टेक द एग इनसाइड. So these are the tuboperitoneal or peritoneal causes that could be the hidden causes of infertility in this patient. The way to diagnose this is by doing a laparoscopy. And we always combine a laparoscopy with a hysteroscopy when we are doing it for fertility purposes. So what is a hysterolaparoscopy? Basically, I will talk about a hysterolaparoscopy when I talk about what investigations can be done. So let me talk about it a little later. So this is the first reason which could be the cause of unexplained infertility. The second, let's move to the uterus. So what happens is that you need a lot of there are a lot of genes and substances that need to be present in the lining of the uterus, which are required for the implantation of the embryo into the uterus. So if there are certain causes like small fibroids, adenomyosis, kiva some problem in the shape of the uterus, I mean gross problems in the shape of the uterus, sometimes implantation can get affected. Now what happens is that if there is a fibroid or if there is an adenomyosis, then usually we have a recommendation that if the fibroid is small, then do not touch the fibroid and there is no need to operate on the fibroid and pregnancy can still happen. But it is also known that women who have fibroids have a slightly lesser chance of conception and a higher chance of infertility compared to women who do not have fibroids. So even when we say that this fibroid is unlikely to be a cause of infertility, we need to understand that because of the presence of fibroids sometimes secrete certain substances, and these substances can go into, they kind of permeate into the endometrium and they can change the up regulation and down regulation. म्हणजे ज्या गोष्टी गर्भधारणेसाठी किंवा गर्भ चिकटण्यासाठी गरजेच्या असतात, जे सबस्टन्सेस ॲट अ मायक्रोस्कोपिक लेवल, त्या सबस्टन्सेस मध्ये because of the substances that are secreted by the fibroid, त्याच्यामध्ये अदला बदल होऊ शकते, and this can again lead to infertility. So sometimes even when there are small minor fibroids which we don't touch, they could still sometimes be a cause of infertility. Along with sometimes we have certain things inside the lining of the uterus such as chronic endometritis, म्हणजे आतमध्ये इन्फ्लमेशन असतं, इन्फेक्शन असतं. ह्या गोष्टींमुळे काय होतं की परत गर्भकोशीच्या लाइनिंगची म्हणजे एंडोमेट्रियमची कपॅसिटी टू होल्ड ऑन टू द एम्ब्रियो डिक्रीजेस. आता ही जी इन्फ्लमेशन किंवा एंडोमेट्रायटिस असते, यू कॅन नॉट पिक इट अप बाय अन अल्ट्रासाउंड, because for an ultrasound you need to have mass You can't pick up, म्हणजे थोडे रक्ताचे शिंतोडे किंवा flimsy adhesions. All these things cannot be picked up by an ultrasound. So sometimes everything will look seemingly normal, but there could be problems inside the endometrium, like I said, chronic endometritis, which can again be a cause of unexplained infertility. So what I'm trying to get at is that it is not that unexplained infertility does not have a cause. It does not mean that everything is all fine. It just means that with the investigations available as on date or as of today, we do not have the wherewithal to find out the causes of the infertility. Like we cannot, by ultrasound pick up endometritis. We cannot look at the health of the tube, how good the tube is, are there any adhesions, just by an ultrasound or an HSG. So that is the reason that we need to do further tests. So these could be some of the causes of unexplained infertility. Now the third factor, what could be another cause? Like I said, the third thing is the sperms. So when a sperm looks or a semen analysis looks seemingly normal, ह्याच्यामध्ये आपण काय बघतो की धातूमध्ये शुक्राणू किती आहेत, त्यांची हालचाल किती आहे, आणखीन आर दे लुकिंग मॉर्फोलॉजिकली नॉर्मल, म्हणजे हे शुक्राणू नॉर्मल दिसत आहेत की नाही. मॉर्फोलॉजिकली म्हणजे हाऊ दे आर सपोज टू बी स्ट्रक्चरली, हे आपण बघत असतो. पण inside the head of the sperm is the DNA of the sperm. When a sperm enters the egg to fertilize it, it is basically only the head part which goes in, and then it is the DNA inside the sperm head which fuses with the DNA of the oocyte in order to have fertilization and and form an embryo. So kadi this DNA which is there, so let me just explain this like this. Yeah. So this is a sperm with the head and the tail, and this is the DNA that is there inside the sperm. When we are doing a normal semen analysis, it is not possible for us to assess the DNA of the sperm because it is inside the head. To assess the DNA, we have to lyse the head of the sperm, take the DNA, and then understand how this DNA is functioning. So if there are breaks in the DNA, या DNA मध्ये जर breaks असले, ज्याला we call sperm DNA fragmentation, again such sperms will not be able to give rise to a healthy embryo or will not result in an embryo even after fertilization, and hence it could be another cause of why infertility is happening. So having a high DNA fragmentation in the sperm could be another cause of unexplained infertility. The next cause, so we have looked at the sperm factor, which could have hidden causes. We have looked at the tube factor, which could have hidden causes. We have looked at the uterine factor, which could have hidden causes. And lastly, and not the least important, definitely very, very important, is the egg factor. So when we are assessing, like a lot of my patients who come to me say कि madam पण माझे माझं ovulation तर होत आहे, माझं follicular monitoring केलंय and my ovulation is all fine. It could be that, but remember that in men as well as in women, and let me talk about women now, every egg is definitely not a healthy egg. It is similarly for men, because if you look at the semen, most of the sperms are going to be, a lot of the sperms are going to be immotile. Many of the sperms are going to be morphologically abnormal. So many out of all the sperms that are there, only a few are going to be those which could lead to a pregnancy. But in men, what happens is that the complete quantum of the sperms that they have is being released in every ejaculate. So every time there is an ejaculation, whatever is the quantity and whatever are the motile sperms and the morphological normal and abnormal sperms are all available for us to use. Whereas in women, सगळीच eggs, like I said, जर चांगली नसतात, तर every month when you are ovulating, if you are bringing up the unhealthy egg at that point in time, then you are not going to end up conceiving in that month. So just because you are ovulating does not mean that everything is fine with your ovaries. You need to understand how these ovaries are functioning internally. So ह्याच्यासाठी there is a test to understand की ovary मध्ये अंड्याची क्वांटिटी किती आहे, which we call is anti-Mullerian hormone. And we need to have good amount of AMH in the blood, which will show that our ovaries have good number of eggs. But having said that, even when you have good number of eggs, sometimes the quality of these eggs may not be good. And the quality of the egg can never be assessed unless the egg comes out of the body, which happens only during IVF. कारण जेव्हा आपण नॅचरली कन्सीव्ह करत असतो किंवा जेव्हा आपण इवन इंट्रायुटराइन इन्सेमिनेशन करत असतो, this egg is being released inside the body of the woman. So there is no way for anybody to assess what is the quality of the egg that is being released inside. So this whole process is happening inside. So at times the quantity could be a problem, and lower the AMH, lower are the chances of conception. It does not mean you cannot conceive. It does not mean that there is, even with treatment, pregnancy cannot happen. But it definitely means that you could have a slightly more difficulty in conception compared to somebody whose AMH is normal. And like I said, egg quality could be a problem. Ki egg quality, there is a problem, and this egg quality is not good, and hence pregnancy and a healthy embryo is not being formed. So this could be the cause of unexplained infertility pertaining to the ovary. So जसे आपण 4 factors बघितले, which could be one of the causes of infertility: the sperm factor, the oocyte factor, the tube factor, and the uterine factor. तसेच there could be problems at the subtle level of each of these organs, which actually could tell us what is the cause of the unexplained infertility. Like in the egg, the oocyte quality with the ovaries, the sperm DNA fragmentation with the sperms, the tuboperitoneal problems with the tubal factor, and the genes and the substances that are required for implantation, chronic endometritis, and other issues which could be present at the uterus level. So now over and above these things, there could be some other factors that could be the cause of unexplained infertility. These are not very common, but these are present. So somebody who is actually having unexplained infertility for a long period of time, जी लोक खरंच ग्रासलेली आहेत ह्या प्रॉब्लेमनी की बरीच वर्ष बाळ होत नाहीये आणि कॉज सापडत नाहीये, त्यांनी अवश्य आणि नक्की ह्या गोष्टींकडे ज्या मी आत्ता सांगणार आहे त्याच्याकडे लक्ष द्याव्या. आणि व्हॉट आर दोज? One is that there could be a problem at the level of the fertilization process. So what do we mean by that? Again, let me see if I can show it to you. Okay, so this is actually depicting the process of ICSI, but okay, I will try, and I don't know, I know this is not very clear, but this was very handy and I thought showing you something will help. So आता इथे जर तुम्ही बघितलं, this actually is depicting an ICSI process. ICSI म्हणजे काय करतो आम्ही की हे जे oocyte असतं अंड, त्याच्या आत एक इंजेक्टिंग नीडल घालून एक स्पर्म त्या एगच्या आत घातलं जातं. ओके, बट व्हॉट आय वॉन्ट टू टेल यू इज, आता हे जर तुम्ही हे अंड बघितलं तर देर इज अ कोट दॅट इज कव्हरिंग दिस एग. This coat is called the zona pellucida. Okay, so it is a thick coat that is covering the oocyte or the egg. Now, the sperm has to come here. It has to pierce this oocyte. It has to pierce the zona pellucida and go inside the cytoplasm of the egg to cause fertilization and create an embryo. Now, this can happen only if the fertilization reaction happens between the oocyte and the sperm. So when the sperm comes here, there are certain substances that are required for the sperm to pierce the zona and go inside the egg. If the sperm cannot pierce the egg due to whatever reasons, it could be because the coat of the egg is very thick. It could be because some of the processes or substances that are required for the penetration are not present, or it could mean that that particular egg and that particular sperm somehow are incompatible to cause the fertilization. If this happens, it is again one of a common cases or causes of unexplained infertility. So people who have a long-term unexplained infertility could be having a likelihood of having a problem at the level of fertilization. Unfortunately, there are no tests to understand whether there is a problem at the level of fertilization. But if there is, then in vitro fertilization or IVF is the only way to overcome this problem. So this is one of the causes which we do not understand, because even after doing the tests that I just mentioned, I will talk about them, you will still not find a cause, and this could be one of the reasons of unexplained infertility. What could be the other reason of unexplained infertility, or sometimes even repeated miscarriages? Sometimes there is an immunological factor. Now, what do you mean by an immunological factor? If you look at the way our body is, our body will always fight off something that is not our own. सो आपल्याला जर काही इन्फेक्शन झालं तर वी प्रोड्यूस अँटीबॉडीज, राईट, आणि वी विल ट्राय टू टेक इट ऑल आउट ऑफ द बॉडी. आपल्याला सपोज फॉर सम रिझन इफ वी हॅव टू टेक एनी अदर ऑर्गन और लाईक अ लिव्हर और अ किडनी और वॉट एव्हर, बिकॉज इट इज नॉट recognized as self, we are going to reject this organ or whatever it is. Okay, now what happens sometimes is that we are producing antibodies against our own cells. So we are creating an environment which is not conducive to the pregnancy. So we create antibodies which will reject the pregnancy, or we have a tendency to not accept the embryo. During pregnancy we call it an immunomodulation. Okay, the immunology of pregnancy. During pregnancy, the body decreases its immune reaction to allow the embryo to implant, because in an embryo 50% of the material is not self, it is from the husband, right? So you are not going to have everything from your own body in a pregnancy ever, right? So that is what is happening, that the immune response is happening. But sometimes in immunological causes of infertility or immunological causes of recurrent miscarriages, the body is rejecting or preventing that pregnancy from implantation due to immunological factors. So this is another cause which usually is not explored and not understood, but could be at the base of the unexplained infertility. So what I have tried to do just now is give you a basic understanding की जेव्हा जेव्हा आपल्याला unexplained असं वाटतं त्यावेळेला सुद्धा there could be subtle causes which are giving rise to infertility in the couple. मग हे कॉजेस आपण कशा प्रकारे शोधू शकतो? So let's go one by one. So in terms of understanding how the tubal factor is functioning, we can do a hysterolaparoscopy, and also to assess the endometrium, the hysterolaparoscopy will help us. So a hysterolaparoscopy is a procedure, it is a small endoscopic or a keyhole procedure that we do, wherein we put a camera inside the abdomen. So a small nick is taken below the umbilicus and we put a camera inside the uterus and we actually look at the pelvic organs ki uterus कसं दिसतंय, tubes कशा दिसतायत, ovaries कसं दिसतंय, and sometimes we end up finding the cause of the so-called unexplained infertility. Minimal and mild endometriosis is again one of the causes of unexplained infertility initially. So endometriosis is a condition जेव्हा the lining of the uterus, which is the inside lining of the uterus, spills outside the uterus and into the pelvic organs. So when you put a camera inside the uterus, you can actually see कि तिकडे endometriosis आहेत का? Are the tubes unhealthy? Are there any signs and symptoms of tuberculosis, pelvic tuberculosis? Are the tubes adherent? Are they rigid? Are they unhealthy? Are the fimbria normal? Is the tubo-ovarian relationship normal? You can get to know all these factors when you do a hysterolaparoscopy. Also, you can assess the inside of the uterus. Is there any chronic endometritis? Are there any adhesions? Is there a contracted uterine cavity? A lot of things can be assessed when you do a hysterolaparoscopy, and it may help us to understand the cause of unexplained infertility. So hysterolaparoscopy could help us not only to diagnose, but it may also help us to cure some of these things, like if there are adhesions काढल्यानंतर, if there is minimal or mild endometriosis, by fulguration or treating of these endometriotic tissue, we can help to improve the chances of pregnancy. So hysterolaparoscopy serves not only as a method to diagnose, but it also serves as a method of treatment, following which the chances of conception can increase quite a bit and help the couple. The next test is doing a sperm DNA fragmentation test. So this is an advanced semen test wherein we try and analyze the DNA which is present inside the head of the sperm. So if we get, there are grades of sperm DNA fragmentation. Some amount of DNA fragmentation is going to be present in every semen sample. So if the sperm DNA fragmentation goes above a certain level, then we know that the problem or the seemingly unexplained infertility could be because of the fragmentation or because of this poor sperm quality. So we've looked at what we can do for the tubal problem, tuboperitoneal problem, for the uterine factor problem, for the sperm problem, and regarding the oocyte factor, definitely if it has not been done yet, you must do an AMH or an antral follicle count and a good day 2, day 3 baseline ultrasound. What is a day 2, day 3 ultrasound is पाळीच्या दुसऱ्या किंवा तिसऱ्या दिवशी आपण transvaginal ultrasound करतो to look at how the ovaries are. Current assessing the number of follicles which are called antral follicles in the ovary is another very important factor to understand की ovaries कसे function करता आहेत ते. And along with that, generally जेव्हा आपण assess करतो uterusला किंवा जेव्हा आपण गर्भकोशीची लाइनिंग बघत असतो त्यावेळेला ह्या लाइनिंगला पण रक्तपुरवठा कसा आहे हे बघणं is also one of the tests that we can do. Another thing that I forgot to mention or I need to mention is that sometimes there can be cervical causes. म्हणजे the cervical fluid or the secretion in the cervix is hostile. तर त्यामुळे when you have intercourse and the sperms are deposited in the vagina, the sperms are not being able to go from the cervix into the uterus despite the sperms being normal. Current the cervix and the cervical fluid or secretion or the mucus is not letting that happen. Sometimes in the past we used to do a postcoital test. We don't do it really much longer, but in case there is an unexplained infertility, this could be another one of its causes that is causing that. So doing a hysterolaparoscopy, doing a sperm DNA fragmentation, doing your AMH, doing a good ultrasound or at baseline and in the mid-cycle, these are some of the things which will help us point towards the cause of unexplained infertility. Like I said, for immunological factors, there are some other tests as well which can be done, but they are really, the in-depth and nitty-gritty tests, so I'm not going to delve too much into it. So having understood some of the factors that could be the reasons behind this unexplained infertility, let us move on to understanding how you can manage or what is the treatment for unexplained infertility. आता जर सिंपल लॉजिक लावलं आपण की काय कॉज आहे आणि कशी ट्रीटमेंट करायची, तर जर ट्यूब मध्ये कुठेतरी प्रॉब्लेम असला, युट्रस मध्ये कुठेतरी एंडोमेट्रायटिस असलं, तर युजली आफ्टर डुईंग अ हिस्टेरोलॅप्रोस्कोपी there is a good chance, if all these conditions are taken care of, then pregnancy will happen naturally. So hysterolaparoscopy serves not only as a diagnostic but also as a therapeutic tool in such cases, right? Suppose जर sperm DNA fragmentation's index किंवा quantity high असली, तर we need to try and understand ki what is the cause behind it. Is it smoking, alcohol, nutrition, any other factor, varicocele आहे का हस्बंड मध्ये, ह्या सगळ्या गोष्टी टेस्ट करायला लागतात. And by giving the right kind of treatment for the particular cause or by giving good amounts of antioxidants, we may be able to overcome this problem. If there is a problem at the level of the cervical mucus or cervical hostility की ज्याच्यामुळे sperms आज जाऊ शकत नाहीये, under such cases intrauterine insemination किंवा IUI helps. So what is IUI and how does it help in unexplained infertility? So IUI मध्ये आपण काय करत असतो is that we try to increase the number of gametes. Gametes म्हणजे eggs in the woman and sperms in the male. So in IUI, we are giving some medications to have superovulation, म्हणजे more than one egg. आणखीन we monitor this patient, do a follicular monitoring, check how the eggs are growing, and when the eggs are about, they become mature, we time ovulation. आणि ज्या वेळेला ओव्युलेशन होणार असतं त्या वेळेला the husband gives a semen sample. This semen sample is prepared in the laboratory. The semen is washed. The unhealthy and the immotile sperms are taken out. The good motile healthy sperms are taken, and then these sperms are deposited inside the uterus. म्हणजे usually when you have intercourse, the sperms are deposited in the vagina, and when we do an IUI, we deposit the sperms inside the uterus. So what happens is that you have more eggs that are developing in the ovary, hopefully one egg on each side or two and one. We do not want more than 2 to 4 eggs, and so you have more eggs. So in case if that a particular egg which is developing that month, like I said, every egg is not healthy. Even if that is happening, when you have more oocytes, there is a chance that at least one of them is good and will help in resulting in a pregnancy. So just when it is about to ovulate, the sperms are deposited here. So it is easier for the fallopian tube to pick the egg up, and for the sperms which are deposited over here, which have already been washed, they've acquired better motility and better fertilization capacity, and then these sperms can go into the tube. It is very easy for them to travel over here and then meet the oocyte and give rise to a pregnancy. And therefore intrauterine insemination works quite well in people who have unexplained infertility. So when there is a cervical factor or mild male factor or factors like this minimal mild endometriosis, which again could be a cause of the unexplained infertility, in all these conditions intrauterine insemination can really help the patient to conceive and lead to a pregnancy. And lastly, if the problem at the level of the fertility is a problem at the level of fertilization, म्हणजे एग आणि स्पर्म्सचं नीट रिॲक्शन होऊन फर्टिलायझेशन जर होत नसेल तर अंडर सच सर्कमस्टन्सेस इट इज IVF or in vitro fertilization which is going to help the couples. So at times there could be times when we really cannot find out the cause of the unexplained infertility. It does not mean that there is no problem. It rather means that we do not have currently the tests which can pinpoint the exact cause of the infertility in this couple. And under such circumstances, IVF really helps the couple to get over these problems, because IVF will help you to look at the egg quality if egg is a problem, to tackle the fertilization reaction problem in couples if that is the case. It will help us assess the quality of the embryos, and it will help us pick up the good quality embryos and implant inside the uterus of the woman. Another way IVF helps is that we can do segmentation. म्हणजे there are at times, because of endometriosis and subtle problems, where not only is the fertilization being affected, but the implantation, that is the sticking of the embryo to the uterus, is also being affected. And when we are trying to do an implantation through an IVF process, we can have certain methods and modalities which can help us to increase and improve this implantation. So IVF helps us in those ways as well. So to think like what I have tried to cover is what could be the cryptic causes जे आपल्याला ढोबळ दिसत नाहीत पण कुठेतरी शक्य असतात आहेत आणि ते आपण कसे शोधू शकतो. So I've talked about the causes, the causes which could be of unexplained infertility. I've talked about how we can look into those causes, and I've talked about what kind of modalities of treatment will help us, like finding out through a hysterolaparoscopy and correcting those issues, finding about the sperm DNA fragmentation and correcting those issues and helping to reach a pregnancy, doing an IUI and helping to reach a pregnancy, and when you should be doing the IUI, and finally when and how IVF will help people with unexplained infertility. So I've tried to take you through the entire process, and before I end this topic, there is something that I would like to talk to you, which probably people never talk about, which is not discussed in medical terms because it doesn't even exist in medical terms, but I believe it is something, and these could be some of the reasons unexplained infertility happens. And that is something I would like each one of you to kind of think back, because most of the times these are things that are not even discussed with your reproductive endocrinologist or your reproductive medicine specialist. Now what are those? One is a lot of fear-based or trauma-based happenings in the past. So I am telling you this because one good thing that luckily has happened for me is ki खूप वर्षांपूर्वी I decided that I'm going to stop my obstetric and gynae. I mean, not stop. I didn't even start as a consultant with my OBGYN practice, and I only did infertility. So I spent a lot of time talking to my patients and, understanding. आणि बरेच वेळेला over discussions, women come out with की ना मॅम मला ना ह्याची खूप भीती बसलेली आहे. मला हे जमतच नाही. There are some women for whom intercourse is extremely difficult. They are unable to have intercourse at times. There are women who have, have had a difficult childhood, have lost their mothers, and there is some fear factor which is in them, which is somehow not being able to free them up and proceed on this path very easily. There are some women who have experienced some kind of pain associated with previous investigations or treatments, and it's kind of put up a block for them. आणखीन त्याच्यावरून मग ते पुढे जाऊन परत ती प्रोसेस सगळी हँडल करायला डिफिकल्ट होते. Sometimes there are subtle problems at the level of the home front, the level of the work front, which is causing enormous amount of stress. सो ह्या ज्या सगळ्या गोष्टी असतात त्या आपण खूप लक्ष देत नाही. ओके, आपण देर आर अ लॉट मेनी टाइम्स देर इज ओबेसिटी, lot many times that our diet is just very bad. Smoking is happening, drinking is happening, alcohol, and we just tend to think that life will go on like this, आणि आपण डॉक्टरांकडे गेलो आणि औषध घेतलं किंवा IUI केलं आणि IVF केली की आपल्याला प्रेग्नन्सी होईल. बट बिलीव्ह यू मी तसं घडत नाही. We have to make sure that whatever we can heal, whatever we can correct at our personal levels, at our body level, at our emotional level, at our mind level, at our energy level, is very, very important for us to walk this journey of motherhood. So I know that as physicians and allopaths and reproductive medicine specialists, we don't really talk about this too much, but I think this is something that you must at least address for your own self. Look inside, try to see की कशाचे issues, कशाचं दडपण, कशाचा stress आपल्याला chronically आणि सिव्हिअरली होतो आहे. आर देर एनी फियर्स वी आर होल्डिंग ऑन टू? इज देर समथिंग स्टॉपिंग अस फ्रॉम ॲक्च्युअली एम्ब्रेसिंग this aspect of our life? Are we worried that as professional women we will have to put our careers on the back seat? There are so many things which could be subconsciously affecting us, which will show that all your tests are normal but would still stop you from conceiving. So I think that is something all of us must definitely look into, because it could open up that small window which could tell us की हे फक्त करेक्ट केलं तर जी काय अनएक्सप्लेन्ड इन्फर्टिलिटी आहे त्याचं निदान, त्याचं कॉज आणि त्याची ट्रीटमेंट लगेच होऊ शकते. So I think that is all that I would like to say today. And I hope that I have been able to shed some light on what is unexplained infertility, what the cryptic causes could be, how we could kind of take the roadmap towards tackling unexplained infertility, and how we can look at some of the unexplored, personal causes that could be actually hampering our own joy towards parenthood. So thank you all of you. Namaskar. And I'm hoping that we can come up with more and more FB live topics and help you tackle any queries that you have. If any of you have any questions, queries, any feedback, please write to us on info @Xenith. Xenith is with an X, Xenith. Xenith.clinic. सो तुम्ही आम्हाला ह्या ईमेलवर प्रश्न पाठवू शकता. Please do subscribe to our YouTube channel and follow us on Facebook, Twitter, Instagram, and we promise to put up more and more content which will help you and answer more and more of your questions and queries, and we'll be very happy If you have any questions that you want us to tackle, we'll be more than happy to answer these even on an individual level. So thank you all of you and have a great weekend ahead. Bye bye.